Hi, my name is Dr. Hawk. I'm a psychologist with UC Davis Pediatrics. Today I'm going to talk to you about how to prepare for a successful telehealth session with your pediatrics patients. First up, we want to talk about equipment. Make sure that when you're doing a telehealth session, you're using a computer with a camera. A phone just won't work as well for telehealth. Before you call any of your patients, please test your camera and microphone. Ensure that you can hear well and that your patient will be able to hear you. And then make sure to practice screen sharing. Screen sharing is an invaluable tool for telehealth appointments. I'm going to show you how to screen share via Zoom. Other telehealth platforms are very similar. So in Zoom, you can see at the bottom, there's a screen share button. You click the share button, and this screen will pop up, asking what you would like to share. Here's a quick tip. Don't ever share your screen with your patients. Choose just the document that you want them to see. If you share your screen, it's possible that they'll see emails that pop up or other PHI that you have on your computer. So make sure when you're sharing your screen, just to share the document that you want them to see. And then once you click on it, the screen will show up in front of them. I've got some cute puppies for you. After you're done sharing whatever you want, make sure to click that little red button up at the top that says Stop Share. This will take the picture away and move you on with your appointment. All right, our equipment's ready. So now let's think about our space. Where are you? You want to think about the background behind you. You don't want to have too much behind you because it's distracting. And you definitely don't want to have any lights behind you. Lights become large glares in our cameras, and they're very distracting away from you when you're talking to your patients. Try to keep lighting close to your computer, but behind your computer, because you also don't want to be too dark. That can be distracting as well. Think about what you're wearing. You're a doctor, so you want to look like a doctor even if you're not in the clinic. Also think about sound. Peripheral sounds are everywhere, and we want in a telehealth appointment for your patient to be able to focus on you. One way of doing that is to wear a little headphone. If you wear a headphone, then your patient can hear you, but it will block out the majority of the peripheral noise so they don't hear the cars outside your window. All right, we're ready. We've got our equipment and our space. Now we want to prepare right before our appointments. So remember to confirm that your patient has a link to the appointment. Review the chart just like you always would. Know your plan for the appointment just like you always would. And this is very important. Make sure to have any forms that you want to share or go over with the client open on your screen. You don't want to spend time looking through files and opening documents. You want to have them ready to share. So make sure you've thought it through beforehand and you have everything ready to go. All right, now we're in it. So when you're in your session, the most important thing is that you are able to communicate well, both with the caregiver and with the child, your patient. So thinking about caregivers, make sure to explain the appointment process. This is new and confusing for our caregivers. It's important that they know exactly what to expect from a telehealth appointment. Make sure to speak slowly so they can understand you, and you might want to increase your speech volume. It can be difficult to hear over telehealth, especially if your caregiver is not wearing headphones. So slow down your speech and increase your volume. Make sure to listen and validate. These are scary times, and our caregivers and patients are going through a lot. So make sure to take some time to listen to what they bring to you and validate and normalize their experiences. If you're reviewing forms with them, share your screen. Any sort of information you want to give to them, share your screen. It's easier to understand a picture than a person. And always check for understanding. Make sure that they know what you've explained and what their next steps are when the appointment is over. And then finally, when we're talking to our patients, it's important to, first off, actually talk to them. They are the reason that you're having this call. And so it's important that you communicate with the child at some way during the appointment. When you talk to kids over telehealth, it is essential that you are enthusiastic, bigger than you would normally be in sessions. And if possible, try to ignore their difficult behaviors and redirect your attention to the parent. Kids are really distractible over telehealth. They either don't want to participate, act shy, or go and move around and create distracting situations for you. If the child engages with you, talk to them, engage them. As soon as they start to be distracting, just ignore and talk to the parent. This is a really easy behavior management strategy. If you try to get the child to stop engaging in the difficult behavior or continually try to question or command them to talk to you, it's just going to create a power struggle. It's not going to be good. And if you do need to talk to the child one-on-one, especially for your teenagers, make sure you check about privacy. You're in their home, and so it's possible that the parent is standing right there. You can't ensure that they're in their own space like you can at the clinic. So ask before you talk to them about difficult things. Make sure they're able to be in a room and feel private and feel like it's safe to talk to you about these things. And really, that's it. You are going to do great at telehealth sessions, and I absolutely believe that you can do it. Just remember to prepare, 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 and talk slowly, confidently, and well to your family.